Hi, my name's Phil. I like talking about politics, and in this video I would like to discuss the predicted consequences of the government failing to get a grip on the COVID pandemic. Some hospitals are reported to being as little as a week away from running out of beds for COVID patients, and it's not even winter yet. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So here we are. The purpose of the pandemic lockdown in spring was supposed to be to reapply the test and trace program that we abandoned because Dominic Cummings had this mad idea of herd immunity without a vaccine. And so we needed time to reinstall it, get it up to capacity to the point where it could cope. We failed to do so. The government thought it more important to put their efforts into fiddling the figures to make it appear that they were building up an impressive capacity without actually doing so. It worked over summer when the demand was much lower. But something that Boris Johnson and his government have singularly failed to understand during this whole crisis is it doesn't matter what the numbers are. You can announce whatever numbers you like. It makes no difference whether they're true or not. Utterly irrelevant. What matters is it enough? Is it enough? You know, it doesn't matter how much money you spend on something. What matters is, does it amount to what's needed? Doesn't matter how much PPE they say they ordered. What matters is, do we have enough PPE? Doesn't matter how many people their tracing program is contacting. What matters is, are we tracing everyone? And it doesn't matter how many tests they're pretending to carry out. What matters is, are we able to test people when they need it? And the answer every single time is no. If the government want to talk about figures, the figure they should be using is not how many tests they've carried out, but how many tests they've been unable to carry out. Not how much money they've spent, but how much money is still needed. That's what they should be doing. Not how many people they've contacted for tracing, how many people they've missed. If they want to quote figures, quote those figures, because those are the figures that matter. And I was only just saying, was it yesterday or the day before? It's difficult time travel with YouTube. But for all the resistance to another lockdown, and that will be considerable, when the NHS is overwhelmed, there's no choice. You know, the government cannot afford the NHS to melt because then it'll be obvious. They know they've won a lot of votes in a lot of areas that prize the NHS. When those people see just what damage has been done to the NHS, they can forget winning those seats in the next election. And, you know, so what they did is that to try and avoid the NHS melting down in spring, and this is what they would do this autumn. You know, they first of all moved elderly patients into care homes as soon as possible, even if they were infected with COVID. Well, they put that policy back in place last month. Then what they did was to take medics off treatments, routine treatments, and second them to take care of COVID patients and use beds to take care of COVID patients. And now we've just got the news that there are NHS trusts in the north of England that are now planning to abandon their normal routine surgeries in order to have the staff and the beds to cope with the demand that is days away from overwhelming them again. That's more people who are in need of surgery for non-COVID related issues that are not going to be getting it. At the very least, it's going to be delayed. But of course, when you delay surgery like this, it means that your situation can worsen. Liverpool's Director of Public Health was reported as saying, I don't want to panic people, but within 7 to 10 days, our hospitals will be at the level they were at the peak of the pandemic. So in October, it's going to be like it was in April, except worst, of course, because April was heading towards summer, you know, some respite. Routine treatments were put off, but summer's relatively quiet time of the year. It was hoped that they'd be able to recover some of that. When we reach that point in October, we'll be heading towards winter, the busiest time of the year for the NHS, a time of year that it is not at all equipped to deal with. It's like the Conservatives must have worked out over the past decade. So what's the average demand on the NHS over a full year, and then only resource them to cope at that level. But that means, of course, that for much of the year, and winter in particular, the system collapses. You know, This year, the system is about to collapse for the third time, because the first time was actually the normal winter failings. You know, when COVID was just something we saw on the news, something about bats and open markets in China. Then we had the peak of our first wave, collapsed again. And now we're on the upward slope of our second. Don't know where the peak is there until you're over it. Winter flu hasn't even kicked in yet, so that means it's probably going to melt 4 times. Average new cases per day has increased by about 50% in the last week. Deaths has increased by about 25% in the same time. So we know that the government's measures, both national and local, are not working. This is absolutely key. You know, Labour leader Keir Starmer painted a disturbing picture on Wednesday with figures that showed in the vast majority of the areas with the tightest restrictions, the rate of infection was still going up and going up quickly. Also, the fact that the restrictions are not being applied according to scientific analysis but political analysis, that's not helping either. Nottingham, for example, this is actually the most confusing example. Nottingham has the highest rate of COVID infections in England right now. There are no local restrictions in place. And I'm not sure why. I'm genuinely not sure why. Now, we know from last year that the government have been easing off conservative areas with restrictions, but Nottingham's Labour. I don't get that. In fact, the city council leader has actually called for restrictions. They've asked for them. Local authorities can't apply them themselves because we don't devolve this matter to local authorities who would do a better job of it. The government have insisted on controlling everything from Downing Street. I mean, I've heard of the London-centric political view messing things up for the rest of the country. I mean, I'm in the rest of the country. I've seen it for myself. But having the entire national response managed from one house in London, that's taking the piss. Thank goodness for devolution. There's at least a few million Brits can have a better deal out of this mess. And the predictions of hitting peak 1 numbers in hospitals was just the start. The chief medical officer convened a meeting with MPs that warned that we would be exceeding the level of demand that we'd experienced in spring by the end of October. Now, coming back to Liverpool, they said that they have, just to put some figures into it, 400 beds that are suitable for treating seriously ill COVID patients. 400. In the last week, the number of those beds in use for these patients has gone from 100 to 200. So if it doubles again in the next week, then that means they've reached their capacity in a week. You know, but we're talking about in general in the Northwest reaching it in a few weeks. And all the government have to say about it is that they are preparing to impose further restrictions. I mean, just the messaging on that is appalling. It's like, oh yeah, there's this problem. Right, I'll tell you what, it's weekend. I need to go off grouse shooting at the weekend. But on Monday, I'll be right back on it and we'll put some restrictions in place for you. Just hang on. Have a good weekend. Be back on Monday. But then people will be facing up to 3 facts about this. 1, yes, with the rate of infection completely out of control, which is clearly what's happened, tight restrictions on contact between people is the only way to wrest control back. The only way to get control back is to stop people coming into contact. When your test and trace cannot cope, all you can do is to stop the virus being passed around is to just tell people who do not know if they're infectious or not, just assume you are and don't go near each other. That's what the restrictions are needed for. Sure, but 2, the restrictions that the government have been putting in place have not worked. They are imposing severe social and economic pressures on regions and households, but they are not working. If people could see that they were working, then they might accept the sacrifice because it would be time limited. But they're not working. The situation is getting worse, so there's no end in sight. So the sacrifice to many people is pointless and endless. 3, the government continue to undermine their own rules by allowing those amongst their number to ignore them and get away with it. If the government accepted their own rules and accepted the punishments when they broke them, if they mucked in with the rest of us, again, people would be more willing to accept the sacrifice. But people don't like the do as I say, not as I do attitude. That makes people less keen on following the rules. So government announced rules, tighter restrictions, what are restrictions? They're just government rules. They announce these rules. People look at it and says, well, one, you're not following your own rules. And two, they're not working anyway. Why would people follow them? And throughout all this, the government have also allowed the media to spread misinformation about the issue, meaning that we cannot even trust to the public's common sense, because common sense has been warped by lies and illiterate reading of scientific conclusions. Much was made of excess deaths as a measure of the impact of COVID during spring and summer, because there was an awful lot of changing in what classes a COVID death. Throughout 2020, the government have kept changing the guidance on what you put down as a death caused by COVID. And it is difficult, I'll grant you, it's tricky. But, so that's meant, and also there's been people dying of things that they would have had treatment for ordinarily, but there hasn't been the doctors and nurses available. So it's all related, directly or indirectly, to the COVID pandemic and our failure to meet the challenge. So excess deaths was used as the only way of really telling the impact. And a lot was made of the fact by Boris Johnson and Matt Hancock, actually all we're doing is popping them off sooner rather than later. It'll even out over the rest of the year because they wouldn't have lasted the year anyway. Which was callous enough, an attitude, callous enough. But over the summer, yes, those excess deaths were reporting negative figures. They've started to become positive again. So anyway, those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.